We've got to be smarter about how we provide health care. We have to be able to go meet those who are in need of the health care where they are, rather than wait till they get in such straits that they come to our emergency room.
With 1.2 million uninsured in our community, we want to be out there at the forefront providing basic primary care services to lower the overall cost of health care. The name of the game in healthcare is we got to figure out a way to lower the cost.
If you can provide this type of care and not have to spend that money in an emergency room, the outcome for the patient's a lot better and the outcome for the taxpayer's a lot better.
Harris County is growing by 100,000 people per year. Even if we were to double our size, there would still be a need for more capacity. We, the Harris Health System, cannot do everything for our community. We need partners.
You know, if we didn't have Vecino now, we'd have to invent it.
Vecino means neighbor, like neighborhood health center, and that's kind of what we are.
It offers dental service, medical service, and it offers counseling services.
We serve people regardless of ability to pay.
We have a beautiful facility, we have top-notch equipment, we have doctors who could work anywhere they wanted to, but we choose to work here.
We actually started operations in 2001 out of a local church. Probably did about 500 visits that first year. And you fast forward 2012, we had 55 employees. We did 27,000 visits, took care of 8,000 patients, a budget of about $5 million a year. We're standing in front of the original building. It's been renovated twice. This building was a cantina. Prior to us renovating it for our first medical clinic, had a notorious reputation in the neighborhood.
There were shootings. So to actually preserve some of the original structure that was such a negative and to such a positive for the community was huge.
We're at our airline facility. It's our newest clinic. It's a pediatric practice. This is really a critical piece of our financial strategic plan to improve our sustainability. If you look at it, costs us $120 to do a medical visit to an uninsured patient. They pay about $20, so you lose $100 on each one of those visits. And so what we wanted to do was figure out a way to cover those costs with other revenue sources. What we thought was, well, Medicaid covers who? Mostly children. So if we do a pediatric clinic, the assumption was, most of those kids are going to be insured, either have Medicaid or CHIP. And what that does is it helps us, not only provide the care that we're doing now with the patients, but it puts us in a position to be able to expand. And that's the issue is sustainable expansion. That's what we want to be able to do.
They've had measured growth. Each time they've expanded, they've been very wise about it. They don't expand past what they believe is their ability to provide the operational support.
It was first a medical clinic. They now have a dental facility. They now have mental health. They purchased a pediatric clinic. They're on their third expansion. So it has certainly been a huge success story, and you can't help but want to continue to be involved with it.
The Freeze Foundation, who gave us all the funding for all of the property, gave us funding for these 2 vacant lots that we have right here.
We were involved from the very beginning, from the very beginning when it was obvious that there needed to be an expansion. My father even said at that time that in the future he would like to see if there wouldn't be a possibility to purchase adjacent property, make sure that this facility could expand. Well, look, we're ready now for the third expansion.
What we'd like to be able to do is we're going to expand this building 5,000 square feet to the end of this lot, and it'll be one continuous building when we're through. We're very fortunate that we've got PBK architects that are going to do the work on this facility as well as the airline expansion. They got 30 years of experience in the industry, very well known throughout the city. Besides David Weekley giving us support, financial support, he's also made a referral to a construction project company. They do this for a living, Forney Construction. Tom Forney, the owner, has actually agreed to do the project management of the construction for us on a pro bono basis. That's unheard of. I've never had that kind of experience with me that could look out for us. We're going to be able to expand the number of exam rooms that we have from 11 to 16. That'll give us the ability to hire another family medicine physician to take care of another 500 families. It'll also give us exam rooms that we need to bring in specialists like cardiologists for our hypertensive patients. We'll also expand our support services for our patients like eligibility. You know, we need to help our patients get enrolled in Medicaid if it does get expanded. We need to help our patients get it into the health insurance exchanges. Now at Airline, when we acquired Airline, we got 1.5 acres of property behind the facility. And so we own that property as well. Basically, we're looking at doubling the size of the organization within the next 5 years. We'll add about 6,000 patients to our patient population through this expansion. And that's kind of what we've done over the past 5 years, was about probably more than doubling the organization.
You know, we're so supportive of Vecino and what they're doing. And we hope they can continue to grow, because certainly the population in need is going to continue to grow.
With this particular expansion, it's multi-purpose. It's really to meet the expanding needs of the community, but also for them to really be able to leverage their strength and their reputation as they continue to grow.
At the end of the day, it's not about money. It's about what are you doing to benefit those that have great need. When you can really help somebody, really makes a huge difference in their lives, how do you place a value on that? They're human beings. They're God's creation that have needs. And if you have the ability to take care of those needs, then you have to do it. You give them hope.